Welcome to our COVID-19 Tippecanoe County press briefing. My name is Dr. Jeremy Adler. I am the Tippecanoe County Health Officer. I am joined today by Commissioner Tracy Brown, Mayor Dennis and Mayor Rosworski, Dr. Bean and Dr. Wickert, and also joined by Dr. Ramirez from the Protect Purdue plan. Thank you all for joining us today. As many of you are aware, COVID-19 has reached a crisis level in many areas of the U.S. States like Texas, Florida, and Arizona are experiencing significant problems with COVID-19. Dozens of other states are reporting increases in COVID-19 cases, including Indiana. Here in Tippecanoe County, we have seen an increase in our new cases since the end of June. So I'm going to go through some of our local data to share with you right now. Before we get to the data, first, our 5 points that the health department has been following closely are: number one, the number of new confirmed COVID-19 cases in Tippecanoe County; number two, the percentage of COVID-19 tests that are positive; number three is the number of COVID-19 hospitalizations, including the number in the intensive care units and on ventilators; number four is the number of emergency department visits for respiratory illnesses; and number five is the number of deaths due to COVID-19. This slide summarizes our current data. As of today, we have a cumulative number of 802 confirmed cases of COVID-19 in Tippecanoe County. 497 of those individuals have recovered. We've had 10 deaths, leaving us with 295 active cases. In the last 28 days, we've had 305 new cases. In the last 7 days, we've had 68 new cases, leaving us with 295 active cases. This next slide shows the number of new cases here in Tippecanoe County by day, going all the way back to March 18th, which was the first day of COVID-19 confirmed cases here in our county. And as you can see, at the beginning of May, we had a peak. That number of new cases decreased then throughout May and through most of June. As we approached the end of June, the number of new cases started to pick up again and has remained elevated compared to where it was 1 month ago, although it's starting to decline here a little bit in the last few days. This next slide is another way of showing the same data. This slide shows the average daily new cases of COVID-19 by week. As you notice on the day-to-day graph, the number goes up and down from day to day, so sometimes it's easier to look at the average number of new cases by day. And again, this curve follows the same shape as our previous slide. At the beginning of May, we had a peak, followed by a decrease to a lower number in June, but then as we headed towards the end of June, the numbers started increasing again. Here in the last few days, we're seeing them trail off a little bit, but they're still higher than where they were a month ago. This slide shows our local testing data. So far, we've had a cumulative number of tests of 14,887. The percentage of cumulative tests that have been positive is 5.4%. In the last 7 days, we've had 1,303 tests with a percent positivity in the last 7 days of 5.2%. For the state of Indiana, the cumulative percent positivity is 9.1%. In the U.S., it is 8.7%, 9.7% cumulatively. So current percent positivity is lower than the state of Indiana and the country as a whole. This slide shows a graphical representation of the changes in our percent positivity for our cases, going all the way back to early May through today. We focus on percent positivity because this is a number that tells us whether an increase that we're seeing is due to simply an increased number of tests, or is due to a true increase in incidence of COVID-19 in our county. And as you can see, the number, percent positivity did decrease gradually from early May through mid-June, and then it started to climb again heading into July, and then it's down a little bit here today compared to a week ago, but again, still higher than where it was last month. So we're watching this information very closely, as it will shed a lot of light on on how widespread COVID-19 is in our community. This next slide shows our hospital data. This is combined from both our local hospitals, Franciscan and IU Arnett. What this slide shows are the peak number of hospitalizations by week, going back to late May. And as you can see, the shape of this curve is very similar to the other curves that we had, a higher number at the end of May, dropping down to lower numbers through June, and then increasing again as June ended and headed into July. The top line is the number of COVID-19 patients in the hospitals. The middle line is the number in the intensive care units, and the bottom line are the number on ventilators. So then a recent increase in those numbers. And finally, our number of emergency department visits for respiratory illnesses in the county, as you can see, has increased gradually from mid-May through the end of June, starting to trail off a little bit, but holding fairly steady. So taking all these slides together, all this data together, what we can say in general is that here in the last couple of weeks we've seen a definite increase in COVID-19 activity in our county, and although the numbers are decreasing a little bit here in the last few days, they still remain higher than where they were a month ago. So this is something we'll have to watch very closely, of course, moving forward. And because of this, it's very important for all of us to take the appropriate actions now so that we can keep this curve moving in the right direction, downward, and not going back upwards. So that means that all of us need to be wearing our face coverings when we're in public, especially in situations where social distancing is not easy to accomplish. We also need to be avoiding crowds. We need to be maintaining our social distance of 6 feet, and we need to be washing our hands frequently. Businesses should be modifying their operations and their workplace environments to optimize social distancing. Businesses should be implementing policies requiring their customers and their staffs to wear masks while in their place of business. All of these measures will help us keep things moving in the right direction in our county so that we do not have a massive surge like is being seen in other parts of the country. I did want to add that we have, in addition to our Indiana State Department of Health testing site at Durgan Elementary School, we are very pleased to announce that we have an additional testing site in Tippecanoe County for this week from the Indiana State Department of Health. That testing site is located at White Horse Christian Center on Cumberland Avenue in West Lafayette. It is operating through Saturday, July 18th, from 9 a.m. to 6 p.m. It is possible the site may be in operation next week. We don't know yet. This site offers free testing. It's a drive-through testing site. No appointment or doctor's order is needed. And this is in addition to the testing site at Durgan Elementary School on 18th Street in Lafayette, which is open Monday through Friday from 8 a.m. to 8 p.m. That testing is also free, and no appointment is needed for that testing. So to summarize, we really are at an important point as a nation, as a state, and as a community with COVID-19. We're seeing in other parts of the country a true crisis level in COVID-19, and we need to do everything we can here locally to avoid that situation from occurring here. And that means that all of us need to be wearing our face coverings when we're out in public. We need to be avoiding crowds. We need to be maintaining our social distance. We need to be washing our hands. If we're sick, we need to stay home from work. We need to make sure that we are doing all the appropriate actions and acting responsibly so that all of us can remain healthy. That concludes my remarks. I'd like to turn things over to Commissioner Tracy Brown.
Well, and I want to begin again by thanking everyone who has participated in this endeavor for weeks now, and for our technical crew that's able to help us stream this to a lot of people in our community. I know the natural question is going to be why the difference between Lafayette and West Lafayette and Tippecanoe County in terms of mask wear. Where we are right now, obviously West Lafayette is mandating mask wear. Tippecanoe County and Lafayette have not followed suit in that. For me, it is an issue of enforcement. Who do we have enforce that effort? Is that going to fall on the shoulders of law enforcement or our health department, which are already taxed beyond belief with just their normal day-to-day calls? It doesn't mean that I'm not, and that the Board of Commissioners is not in support of mask wear. We continue to promote all of the measures that can be taken to help stem the growth, the rate of growth in the virus. We just would rather people do that now of their own free will, their own choice. And I might add that today we had, if what I saw on social media was true, it looks like at least 2 other major retailers have announced today mandatory mask wear. I think Walmart and Sam's have joined Menards, which has had that policy in place for a long period of time now, and many other retailers and places where you get people congregating in volume have followed suit as well. So again, that is where we are right now, and I would certainly invite the mayors if they have additional comment on that or questions. We've been taking emails in light of the decision in West Lafayette, and it's probably close to an even split. I've got people that have sent emails that have said, hey, we appreciate the fact that there isn't a mandate, and I've got some folks that are upset that there's not a mandate. So that's where we are, and that's the thought process.
Thank you, Tracy. I'll just continue by saying, first of all, again, thank you to the group and what everybody has done to work here together, and I appreciate the effort, and I think it's been helpful to all of us, and I know that we'll continue to have good civil dialogue, even if everybody doesn't exactly align or agree. I think that's part of what makes this country great, that we can have those types of conversations. But as Tracy said, I think it's important that everybody knows that, we are taking these decisions very seriously. I feel sometimes from people I speak to, they almost feel like we sit here and at the end of the night we go to some planet where we're by ourselves, but we're not. I have 4 children and 7 grandchildren, all of which live in this county or one county removed. I have an 84-year-old I have an 84-year-old father and a 77-year-old mother-in-law. So the decisions that I make professionally for this community affects me personally, my family too, and so we are all in this together, and I think that's important that we all remember that. And so, I monitor, I participate in these, I look at the numbers very closely that come out at the local and state level, and monitor several other websites to see where we are. And as Dr. Adler said, there's been some movement upward and some movement down. Some of the movement's been down, it looked like, from those slides since July 3rd, actually. And so I think for me, I'm going to continue to watch the data, to listen to people, to try to stay well informed, to make those decisions that I think are the best for our community. I'm like Tracy. I would much prefer that citizens, if at all possible, until it's just not possible, be allowed to make their own decisions. And I would like businesses to be able to make their own decisions. I typically think when things are driven by the citizens and by private business and people are making those decisions as opposed to being drove by government, we get long-term better outcomes and long-term better solutions to problems, whether it's this or anything else. And so, we're going to continue to watch this closely and to look at the situations like hospitalizations and ventilator use. And I know that the hospitals and everybody have done a great job. In fact, we don't have to use ventilators near as come up with a new piece of equipment, so ventilators don't have to be used as often, and some other treatments that are working. And so I'm going to continue to be a part of this group and continue to monitor it. But right now, I don't see the data. I don't see those things that would make me take that next step to take away those individual freedoms or those individual choices from people yet. And I'm happy that Walmart and Sam's are doing what they're doing, and I would encourage other businesses to do the same. And like we've always said, encourage you to wear your mask whenever you can't socially distance, wash your hands, do all the things that we've been talking about. Encourage others in your family to do things, and let's keep pushing the number of people that are complying with that in the right direction. And the other big point for me, as Tracy indicated, I just want to make it clear, I will not use the Lafayette Police Department to enforce mask policy. I feel that they have other duties and responsibilities that are larger than that, and I also feel it would put them in a very difficult situation with all the exceptions that are in it and HIPAA requirements and asking medical questions of people or why they're not wearing the mask, and it's just not something I would use our law enforcement to be a part of that. And from a personal level, I just not in favor of fining people. We've got a lot of people that are struggling to make rent, make their house payment, pay their utility bills, buy their groceries, pay for prescriptions, and us throwing another fine on that somehow during this just feels wrong in my heart. It just doesn't feel right to me, and that's just not something that I'm in favor of.
Thank you. Mayor Dennis, any comments?
Yeah. I guess I'm on the other side. I think everybody knows the relationship that Tony and actually all the commissioners and I have. And that doesn't mean that we always agree. And this is one of those situations and circumstances where we agree philosophically, but we don't agree operationally. When I made the decision to mandate masks for the city of West Lafayette, it was all predicated on what the feedback is I'm getting within my community. There's an overwhelming response, whether it be through email or whether it be through the casual conversations that you have when you're out in public, about people wanting a mask mandate, about the citizens that I serve concerned, not just about the casual interaction they have, but about the interaction that they have when they're not in control of their own environment, such as when they go to the grocery store, such as when they go to Walmart, when they go to Menards, when they go to Meijer. And they felt that it was something that isn't that big of a deal, but it's the right thing to do. And oftentimes doing the right thing creates a lot of challenges, specifically in an open society like we have here. I stand by my decision. And I know my partners are by my side, if not necessarily in agreement with me. But we need to do something to turn this around. And Dr. Adler has made this abundantly clear. Two of the biggest things that you can do is social distancing, and when you can't do that is to wear a mask. The numbers are trending the wrong way. They're going up. There's things that we need to do as local elected officials to do the right thing. And everything that we do, if we abide by those policies and protocols, this is going to end a lot faster. Everything we're doing right now is temporary, regardless of what we're doing. And as soon as we can get this under control, it'll be a memory, and that's what we're hoping for. Lafayette, Tippecanoe County, and West Lafayette do so many things together. The partnership between the three of us is tighter than most forms of local government. I wouldn't say not even in the state of Indiana, but in the country. And that's not going to change. Our hope is that when this is over, we can look at what we did and look at what we didn't do and learn from it. Our population bases are somewhat different, yet somewhat the same. And again, the information that I'm getting from the people I serve is to mandate a mask requirement, and that's exactly what I've done. Our enforcement mechanism is going to be through our neighborhood resource team. We've got a group of individuals that work on quality of life issues. They'll be the ones that will be tasked with encouraging compliance with the ordinance. It's actually an executive order. The other thing that we have is, because of the density of our population base and with the reality of 40,000 plus students coming back into our community, there needs to be consistency on what we do, Purdue has mandated a mask requirement for their students. The city of West Lafayette is doing it in kind. The hope is that will create a much healthier environment for our entire community because the students get around. And more importantly, it'll make sure that what we're doing here, we can continue to do. One thing nobody wants to see is us going back to a locked down community where businesses are shut and our economy tanks. We could not survive another shutdown. So I feel by making the small request, back to the small mandate of asking that my community wear masks is a very small sacrifice to make for the greater good, not just of West Lafayette, but for this community.
Thank you. At this time, we will entertain questions from the media and from Facebook Live.
Hello, this is Anna Darling from WLFI. This question is more directed toward Mayor Wazorski and Commissioner Brown. People in places like Texas and Florida, where we're seeing such a spike, were left with their own decision to wear masks and things like that. Is there any concern about, leaving people to their own devices to make that decision and then making the wrong one and then it leading to more cases?
Well, I mean, I think you always have that concern, but I think each community is different, and the dynamics of each community is different. And, I think we did a much better job here early on than some of those places did. And I think our citizens are responding better than most places did initially, and I think they still are. And I think our citizens have done a good job. I mean, it's been a group effort between the hospitals and healthcare providers, law enforcement, police officers, firefighters, everyday citizens, people in our grocery stores. I mean, I think people have overall done a good job, and it's been looked at differently and in a different frame where people might have just totally blown it off or thought it was a hoax or, something. I don't think we had very few people that thought it was a hoax, and certainly nobody around this table thinks that, and that, we'll continue to monitor it. To see, because again, I need to look back through. I see the information as a little bit mixed. I see actually that the numbers are going down in some areas and have been for a couple weeks in a couple of them, it looked like, and are back to some lows of some earlier times. And of course, when you look at some of it, you look at June the 14th and when we opened certain things, and all those things come into play as we look. But Dr. Adler said it correctly. We've got to be careful and diligent. We've got to watch it very closely. And, nobody here is all of a sudden we should let our guard down, or we're out of the woods, or we're not going to pay attention to things. We're saying just the opposite. We're going to continue to pay attention to things and adjust accordingly if necessary.
And thank you, Anna. That is a fair question as we watch what's happening in Georgia, Texas, and Florida. And I know someone personally who traveled to Florida at the end of May, Memorial Day weekend, and came back and said, I can't believe how loose it is there. There was no social distancing on beaches or in major urban areas, and no mask wearing once you got off the plane at the airport and things of that nature. Quite frankly, I'm not surprised that they've had a huge surge in Florida where they had, I think, 15,000 cases reported on Sunday. We have handled it differently in the Hoosier State, and we've handled it differently here. And again, I'm sure that the folks that traveled there had to question, boy, we're not doing this in Indiana, but and they're it's a little freer in Florida. Now it's pretty obvious what that brought them. So mask, hand washing, all the things that brought us to today are still critical.
And I think that's important what Tracy and what we've all said too is, or at least for me, I won't speak for the rest of the group, is the consistency. I've said all along that we would closely monitor and follow what the governor had prescribed for the state, and the governor has taken at times when there has needed to be extraordinary action with areas where he extended shelter-in-place orders, he extended not allowing people to go to different stages, and then put in different protocols, send in strike teams. And so, I've made it clear all along that we would continue to follow that guidance also. And to this point, and I talked to some of his staff last week, he has not seen a reason to institute a statewide mandatory mask program, or as far as I know, make any individual city do that from the information that he has seen so far and his State Department of Health has seen. And so, we've also tried to stay, and I have tried to stay, and this group generally has tried to stay consistent with that guidance also. And to the best of my knowledge, he has not seen a need for a statewide mandatory mask, which if you were going to do mask, that would be the best way by far to do it if we were, because of the way people move back and forth and go to a place that doesn't have one, and then it's confusing and people are moving everywhere.
Ron Wilkins from the Journal and Courier. Dr. Adler, help me, that slide went rather quickly.
Okay.
You said we have 14,887 tests since March, and of those 5.4 are positive. Last week you said we had 1,303 and 5.2 are positive. How are we just seeing more cases because of more testing, or because it looks like the percentage of positives is going down? Can you address whether what we're seeing here is this because of more testing, or is it because of more infections?
Sure. So one of the reasons why we look at this percentage, which is known as the percent positivity, is to help answer that question. Because, of course, as you test more people, you're going to discover more cases. So, of course, your total number of cases will go up as you test more. So the question is the increase in cases due to simply testing more, or due to a true increase in the incidence of COVID-19? And that percent positivity helps answer that question. The World Health Organization has stated that the goal for that percentage is 5% or below. Once you get above 5%, then you're looking at a true increase in incidence, rather than just an increase due to testing alone. Once you cross 10%, then you're really getting into a situation where you are not testing enough people. You're actually missing cases because the incidence is high enough. To put that percentage in perspective, 2 counties in Florida have a percent positivity. One of them is 19% right now. Another one, I believe, last week registered at 28%. And so, of course, that is an indication of how rampant the COVID-19 virus is spreading in Florida. This slide that I brought back up here shows the trend in that percent positivity here for us by week, going back to early May. And you can see that the shape of this curve follows the same shape as many of our other graphs that we're showing, where you have a higher number in May, dropping down as you head into June, and then starting to increase up again as June came to an end, and then into early July. So it's something that we watch very closely. For example, last week, that percent positivity for last week was 7.5%, and now this week has dropped down to 5.2%. So that's a step in the right direction. It was much better when it was less than 5%, like it was in parts of June, and that's the goal that we're wanting for our community. So we're watching that very closely, because it helps to answer that question about whether increases in numbers are from simply more testing or a true increase in incidence of the disease.
Just follow up to make sure that my eyes are correct.
Okay.
It looks like 2.3 was the lowest percentage in June.
2.1.
2.1?
2.1, yes.
And 7.9 a couple weeks ago.
Correct.
Okay, thank you, sir.
And then 5.2.
5.2 now. Yep.
5.2 currently, yes. Okay.
Our lowest point, it looks like the 2.1 was in June, right before the June 14th, when things opened up to the 15% or 50% level, which I guess you would probably think there would be an increase once you begin opening up your communities.
Anna Darling from WLFI again. This one is for Dr. Ramirez. Just want to know if there's any updates with the Purdue plan, any changes in the past 2 weeks, and your Purdue's thoughts on the West Lafayette mandate.
So no drastic changes. Actually, we've started our testing now. This is our second week of testing our students that are on campus. It's going well. Our protocols are being followed. So that's always good. With any new process, we want to make sure that we're fine-tuning the process, making sure we can be responsive as much as possible and make sure that we can get results in a timely fashion and all that. And so thankfully, everything's been going well from that standpoint. I think Purdue is very happy with West Lafayette mandating the masks. I think more so our students are going to feel supported because again, the border between Purdue University and West Lafayette, it's literally a street. So they want to know that when they look around, they don't feel like, wow, I'm the only one wearing a mask. They are now going to feel like I'm surrounded by folks who are also worried about each other, going to look out for each other. So I think it's a move in the right direction. I think it's a positive move.
Just a quick follow-up question. Have there been any positive cases among the students on campus?
I can't talk about numbers in specific, but we have had some positive cases, and so those students are now in isolation, and we're following the protocols as appropriate.
Question from Facebook Live for Dr. Adler. How do you determine when to alert the public of a cluster of cases?
Yeah, that's an excellent question. So when we have positive cases, of course, those cases are investigated, contact tracing is undertaken, and if we see a common link between cases in terms of perhaps a certain location, then we want to investigate that more closely. And typically, if we see, say, 5 or more cases that are linked together with a particular location, we'll consider that a cluster, and we take extra steps to make sure that we are educating the other people that may be in that location to really watch for symptoms. We make sure that we're quarantining the close contacts within that cluster.
Question from Emily with Journal and Courier. What was Tippecanoe County Health Department's role in the school reopening plans, as some K-12 schools in Indiana are pivoting and choosing to re-enter the year with e-learning only? Is that something that could happen here in the county, and what is your guidance?
So for our role, we did meet with the leadership of all these school systems in the county. We provided guidance and recommendations. The guidance and recommendations that we provided were the recommendations found in the Indiana Department of Education in-class document and also the CDC's guidance for reopening schools. So everything that we advised was consistent with those guidelines. As far as the schools themselves going to an e-learning situation like some schools and other parts have, that's really a question for the schools to answer and to determine whether they're going to start the school year out that way or not.
Question for Dr. Bean and Dr. Wickert. What is your current census for COVID patients?
So I'll go first. So again, Jim Bean from IU Health Arnett. We've seen an uptick. So we currently have 32 patients in the hospital, 5 of whom have confirmed disease, and the remainder are under investigation. So a significant bump in the number. I don't know the likelihood of the 27 or so that are under investigation, if they'll turn out to be positive or not, but those are this morning's numbers.
Any in ICU?
It's a great question. I don't believe we have anybody on a ventilator, but it would be single digits in the ICU if that's the case.
And for us at Franciscan, this morning, we had five positive patients in-house and 15 suspects. And I believe one of the suspects were on a ventilator, and they'd be in the ICU.
Question from Facebook Live. Do you anticipate a significant spike in cases when Purdue students return to campus?
Well, we're certainly hoping there won't be, of course, but that's a real concern. Anytime the population of a city or county increases by 30 or 40,000 very quickly, there's always the possibility of an increase in COVID-19, and that's something that we, along with Purdue, will be watching very closely for and trying our best to prevent something like that from happening. Dr. Ramirez, do you have any comments on that?
Absolutely. So that's exactly why Purdue made the decision to move forward and test asymptomatic individuals. We need to try to control this as much as possible before it starts spreading as best as we can. So doing a point-in-time test, such as what we're doing, to test these students before they even arrive on campus. That way, if they need to isolate or quarantine, they can do so away from campus. Again, that should minimize the exposure not only for West Lafayette, but it should also limit the exposure to the university as well. So that actually went into our decision-making on whether to do the test all.
I have a question for Dr. Adler about a specific business. We've had some reports about Christina and Company in Lafayette having some positive employees. And a second part to that, are businesses required to inform their customers if an employee has been tested positive?
Well, I'm not familiar with any cases at the business that you mentioned. The second part of your question was about whether businesses are required to inform their customers. There's not a requirement for that. However, it certainly would be recommended that businesses take steps to protect not only their employees but also their customers, and to keep everyone on the same page in terms of what steps are being taken to not only handle a positive case in their place of business, but also prevent future cases from occurring.
Question from Facebook Live. Dr. Adler, in the view of current data on the spread of COVID within the county, will you advocate for Tippecanoe to revert to an earlier stage of reopening rather than going forward to stage 5?
Well, I think with what we've seen over the last several weeks in our county, and then also with the increase in cases throughout the state, I would think and I would hope that Governor Holcomb does not proceed to stage 5 later this week. I think that we need to proceed very cautiously right now, and we really need to stay ahead of this and not push things too quickly, so that we can avoid the same situation that you're seeing in other states.
Question for Mayor Rosorski. Considering requiring the Lafayette Parks Department to mandate masks for events like Art in the Park.
I was at Art in the Park last night myself personally, so I was able to see what people were doing. We had social distancing set up on every bleacher seat that we had. Every other row was closed off. We had places where people stood in line to get food and those types of things. It was an outdoor event. There were lots of people wearing masks. There were not everybody were wearing masks, but I felt overall people were doing a good job abiding by where we had marked on the bleachers, and enjoyed the evening. And I had several people comment to me that they appreciated the ability to get out and to have an activity like this that was free to the community and hear some music and do some things like that, or take a walk. I mean, there is we've heard all along there is a mental health aspect of this too, of people feeling good about life, not being consumed with fear and anxiety and panic. And so I think an event like that done well, and there was not a huge crowd there. I think our Parks Department did a good job, handling that event and keeping it safe. And I think for some people it was a real mental health boost to be able to do something, because life does have to continue at some level, and we don't want to cause additional problems. We can avoid it with doing some things and doing them smartly.
You all have said that you're in counsel with each other fairly regularly about the situation here. Are you, in a broader sense, are you in counsel with the governor or state Board of Health folks to make recommendations to them about how they should proceed?
Well, at the Health Department, we have ongoing interaction with staff at the State Department of Health about a variety of issues. So we do have frequent communication with the State Department of Health. As for the communication with the governor and the governor's office, I will defer that question to our elected officials.
Ron, last week I met personally with two of his staff members in my office, talked about this and numerous other issues, but I did meet personally last week with two of his staff members, and then got an email yesterday from one of the gentlemen who was there sent me some information on requirements for another testing site, and asked me around and maybe make recommendations to the governor's office for another testing site location here in the community.
They actually came by both of our offices, same conversations. They were just trying to data collect and see how the communities are doing.
Question from Facebook Live. Should people who are going on vacation to Florida or other hotspots be quarantining themselves when they return to Lafayette?
Yes, I think that would be an excellent idea, and also I would advise anybody that's thinking about traveling to other parts of the country, especially parts of the country that are having significant problems with COVID-19, to really consider postponing their trip. Now would not be a very good time to visit Florida or Texas or Arizona or California. These are states that are really, as I said earlier, are actually in a crisis with COVID-19. And so I would urge people to really strongly reconsider traveling at this time to those areas. Okay. If there are no other questions, I'd like to thank everybody for showing up, and we'll see you next time. Thank you.
Yep, thank you.